We've got this evidence from circulation. I've been told by this whistleblower, let's look at this a bit further. And what happened then was just so bizarre. It was almost around the same time. I don't know if it was, maybe it may have been just after that, Joe. Our Secretary of State for Health, Sajid Javid, gets up in Parliament and says, I've decided we need to pass legislation to ensure that all healthcare workers get vaccinated. And if they don't, they lose their job. Now, we've never done that in this country. I know you've had maybe mandates for other things. We never mandate any medical intervention in the UK. We've never done that before. I thought, this is odd. I said, right now, first and foremost, by this stage, Joe, we knew it wasn't stopping transmission, right? It probably wasn't going to stop infection either. You know, the narrative kept changing. We were told it was going to stop infection. Now it's going to prevent you having severe disease. You know, it kept changing. I said, should be an individual choice now. There's no, healthcare workers are not protecting their patients by being vaccinated. They may be protecting themselves. We'll get onto that data shortly. But they're not protecting their patients. Therefore, there's no reason, we shouldn't mandate this. So then I literally launched into this. I was still, interestingly, at that point, getting mainstream media interviews because people wanted to talk about what happened to my dad and the ambulance delays. So I went on BBC News and I got it in there. I said, by the way, guys, because I said, Dr. Marshall, what's behind our healthcare crisis? I said, well, we've been talking about this for years. We've not tackled prevention. We've got on this obesity epidemic, right? And that's putting more and more stress on the system and has been for a long time without any more resources. We've got an over-medicated population. We've not dealt with that, Up to 1 in 5 people over the age of 65 are hospitalized, Joe, because of side effects, right? And I said, but there's something else we should talk about as well. We could lose 80,000 jobs in the NHS if we mandate this vaccine and people decide not to take it. And that will be a disaster, but it's not scientific and it's not ethical. And then they would kind of cut me off at the end, and then I was on Sky News, so I kept doing this. And then I thought, you know what? I don't just believe in public health advocacy. I'm somebody also that does things behind the scenes. I meet politicians. I've worked with people in very senior positions in the health service, in health policy. I've had roles with those people. I believe in dialogue and conversations and giving people the benefit of the doubt and understanding they may be ignorant or have the illusion of knowledge. Let's have a conversation with them. So I call up the chair of the British Medical Association. And I was in America at the time. I'd come because I live alone now, right? So I lost all my family, and my closest family are in California. And they said, Asim, just come and spend a couple of months with us. So I get to the States around the end of November 2021, and the first thing that happens is I get an email from a very prestigious medical body I'm associated with. I won't name them, and they say, Dr. Malhotra, we've received a number of anonymous complaints from doctors that you are spreading anti-vax disinformation. Purely upon that interview on GB News where I said there's a signal, we need to look into it. That's all I did. So I was like, Jesus, really? And it was obviously stressful. I had to respond, and it took a month, and they left me with a warning at that point. But I realized something else was going on here. So I called up the chair of the BMA. His name's Chand Nagpal. And I said, Chand, I need to talk to you. And he listened for 2 hours. I talked him through every bit of data that I'd come across and things about the vaccine. He said, Asim, he said, I'll be honest with you. He said, nobody I've spoken to in health policy, my colleagues, appears to have critically appraised the evidence as well as you have. Most of them are getting their information on the benefits and harms of the vaccine from the BBC.
Wow.
Now, that is replicated. If you remember, Joe, Rochelle Walensky, a former chair of the CDC, she said in an interview, former director of CDC, that her optimism from the vaccine came from CNN. Right? And that CNN news report, right, that she was referring to, Joe, was almost verbatim a reproduction of Pfizer's own press release.
Wow. That's some great journalism.
Well, it tells you something else. I think that we shouldn't underestimate the impact of the mainstream media in influencing people's decision-making, even people who you think should have better information or know better.
Right.
Right? And that, that's what it showed. So he said, listen, okay, Asim, I'm with you. The medical Royal Colleges and the BMA anyway didn't support mandates. They were kind of silent about it. They weren't proactive. I was probably there was a few campaigning doctors in the UK and an organization called Together Declaration that got involved in it. And I went on the full offensive, through social media, through mainstream media, and said, we need to get this overturned. I had people, nurses and doctors, who were almost in tears, contacting me who were unvaccinated. And I said, listen, hold firm. You know, they passed this in Parliament. Most of the MPs voted for it. It was going to be in legislation. And I said, hold fire. This is not going to happen. Do not get vaccinated if you don't want to get vaccinated. And literally last minute, like a week before this was going to come into effect where people would lose their jobs, the chair of the BMA was speaking to Sajid Javid after speaking to me and all these people campaigning, and we got it overturned.
Wow.
And, you know, for me, one of the most satisfying things I've been involved with is helping to save, in effect, these tens of thousands of jobs in the NHS, especially because it wasn't scientific, it wasn't